Welcome back to Rooted in Impact, a United Way Coastal and Western Connecticut podcast. I'm your host, Ashley Gaudiano, and today I'm joined by Katie Curran, President and CEO of Connecticut Institute for Communities, or CIVC. CIVC plays a really critical role across our region, from providing healthcare to early learning programs and family supports that help individuals throughout our community thrive. Today, we're going to talk a little bit about how CIVC responds to community needs and how innovation in health and early learning can create long-term impact. So, Katie, thank you for joining me today.
Thank you for having me.
We are going to jump right in. I don't know that everybody knows what CIVC is or what CIVC does. So can you just start with kind of the quick high level, who you are and what you do?
Sure. Connecticut Institute for Communities, that's a little bit of a mouthful. So we call ourselves CIVC for short, which is CIFC. The organization was founded in 2003, and our headquarters are in Danbury, but we serve many individuals throughout the region, primarily in Danbury and Norwalk. But we do three main things. We focus on healthcare, early childhood education, and housing, because we see these as three core areas that people really need as foundation in life to thrive. And so the biggest thing that we do in our health space is we run a federally qualified health center, CIFC Health. On the early childhood side, we manage the Head Start and early Head Start programs of both Danbury and Norwalk. We also have state-funded preschool slots in both programs as well. And in housing, we manage the Beaver Street Apartments Cooperative, which is a separate legal entity, but they hire us to manage the property, which is a 70-unit multifamily Section 8 housing property in Danbury. It has 1 through 5 bedroom units, and it's a space we're looking to grow in terms of housing management in the future. But collectively, we work with over 16,000 individuals in the community every year. Primarily patients, but we have hundreds of children in the early childhood programs as well.
That's fantastic. And I think the housing, I say this anytime I talk to people about housing, like we could have a whole conversation.
Yes.
We could have a whole multiple conversations on housing. And you're right, on any of these issues. Why is that integrated approach at looking at healthcare, early learning and education and housing? Why is that so important to you all?
It's just, again, going back to when we think about what anyone in life needs to thrive. You need a safe place to live. Ideally, from an early childhood standpoint, you need access to those key resources early in life that help set you on a pathway towards educational success. And of course, none of us do well unless we're healthy in the world. And as a federally qualified health center, community health center, that's a concept I think some people know of, but we accept all patients regardless of their insurance status, their ability to pay. That's actually written into the authorizing legislation for community health centers in this country. There are over 14,000 community health centers in the country. There's 17 in Connecticut, and we're one of them here. But access is a big part of it, is making sure that regardless of the barriers you have in life, that you can access healthcare.
Yeah. And so you see people from all walks of life with
Yes.
all sorts of needs. What are some of the most pressing things you are seeing today?
I think we've heard a lot about cost and affordability. And if you're already working with families that are, so many of our individuals and families that we work with are below the federal poverty line, which many people don't realize this is a number that is the same, whether you live in Connecticut or whether you live in Alabama, for example. And I'm blanking on the number off the top of my head, but it's a very low number when we think about what it takes to for all of us to make ends meet. And you, as all of you know, and who are familiar with the ALICE term in the United Way world, speak, yes, is the ALICE terminology actually looks at what it costs to live, and meet all those. And it's a much higher number here in Connecticut. So when you think about the fact that 80% of our patients with known incomes live below
Wow.
200% of up to, so we track it for the health center. The data we report on is up to 200% of the federal poverty level.
Yeah,
That's
the
something that our,
federal poverty level for a family of four, right? You could look at it across any is
yes,
$32,150, right? So if you
right.
take a second and then, Katie, what were those numbers again, right? You track 200% of 32,000.
Yes, correct. So of the known income, so not everyone chooses to
Of
tell us
course.
their income, but of those patients who report their income to us, about 80% of those live below 200% or up to 200% of the poverty
Wow.
level. And for us on the health side, that allows them to qualify for our sliding fee scale, which discounts all of our services. Again, that's something that's all community health centers are required to do and that we do. But obviously cost is such an issue, and affordability is, I feel like, a word we're hearing everywhere. But again, if you're thinking about those who are really struggling to get by, that's just they're struggling with everything: access to food, access, hopefully they're able to get access to healthcare through some of the things we offer, but we only fulfill part of that world, right? There's all sorts of specialty services that patients need access to. um, I think also people are struggling with the cost of health insurance.
Yeah.
Many of the families I mentioned, who are below 200% of the federal poverty level, many of them qualify for Medicaid or Husky, as we know it here in Connecticut, assuming they meet other criteria. So, just all the things that we would think people would struggle with, just amplified, I think, in the current environment.
Yeah, and it's just so connected, right? If you don't have a roof over your head or an affordable roof over your
Right.
head, right? It's hard to think about other things. If your health is a concern, how do you worry about what food you're putting on the table?
Correct.
And it's circular and, just one giant web. So, be able to provide some of those services. And then I would assume, right, knowing where in the community you can refer people to for the other
Correct.
services is so critical.
Yes. Yes. Agree completely. Collaboration is one of our core values as an organization, because we recognize that we can't do everything. So having partnerships in the community is so key. We work well with United Way and Nuvance, on some innovative things like the food pharmacy of Greater Danbury. But we also partner with other nonprofits. I know in our early childhood space, one of the things that we do for any child that's in our program is they get all of their meals are provided. Snacks, meals are provided when they're with us. But then what happens when the child goes home? How secure are their needs? So we partner with Filling in the Blanks, which is
Okay.
another nonprofit to
Yep.
help bring groceries home to families. And making those connections is key, because we can't assume that when the school day ends, people have access to all the things that they need to continue to thrive. It goes much beyond what we can give in the school day.
Yeah, absolutely. Katie, Civic is a pretty big organization, and you are really a phenomenal leader. Um,
Thank you.
how are you thinking about balancing, right, the critical needs of today with
Mhm.
kind of long-term strategy? Or are you really, as an organization, focused on the here and the now?
It's always a little bit of both. I think we're very focused on the here and now, because there's just been so much change in the last 2 years. So many changes in legislation that impact us both at the federal level and the state level. Some negatively, some positively. So you always have to be nimble to adjust and respond to those things. But one of the things we're really focused on as an organization, and have been for the last several years, is sustainability. So how can we ensure that we're here 50 years from now, providing
Right.
these critical services? And so, to the extent we can, especially in the healthcare space, in the early childhood space, so much of what we do is almost entirely grant funded, and that
Yeah.
makes things challenging. Although we feel very lucky to be in Connecticut, where there is such a recent emphasis on funding early childhood education. But in the healthcare space, that's a space where the grant funding is such a small, I don't want to say small,
Smaller
it's
percentage.
a smaller percentage of the overall pie, where
Yeah.
we really look at, first and foremost, we always look at what's the community need and how can we adjust our services to respond to community need. But if we do so in a way that's also sustainable in terms of it's supporting other pieces of the health center that are great to do, but potentially lose money and that you have to support another way. So it's always it's a little bit of both. And I think any organization really has to be thinking both short term and long term. I think it is hard to think long term when you just see such a swing in the policy environment. Not all the time, but of course, over the last couple of years. So it's hard to predict what the future looks like all the time. But again, I think we're lucky to be in Connecticut, where we have a lot of supports here that to weather some of what we've seen that may have negatively impacted our patients. So the state came out after changes on ACA subsidies and committed to fulfilling that whole. And so that's certainly
been great.
Critical for our patients that want to maintain coverage, but really struggle with, can they afford to maintain coverage?
Yeah, I think we've seen that support from the state of Connecticut and other areas. Again, in the early care and education space, we've seen that in the food insecurity space. We've seen some additional investment. So, to the extent that that the state is able, it does seem like we are fortunate to be here and have dollars flowing to support these gaps that we know organizations like Civic, United Way, and so many others are dealing with every day, trying to navigate those challenges. Katie, we're going to take a quick break. When we return, I want to just come back to the kind of future of what you may or may not do in the housing space. I'm curious what you're thinking about there. So we'll continue our conversation in just a minute.
Across our region, women are leading the way, raising families, supporting their communities, and creating meaningful change. But we know that leadership and care often come with invisible pressures, especially during challenging times like the holidays. That's where Women United comes in. Through mentorship, volunteer initiatives, and advocacy, Women United empowers women to support one another, strengthen families, and make a lasting impact in our community. By joining, women gain connection, resources, and the opportunity to lift up others while also caring for themselves. You can make a difference and be a part of a network that changes lives. Visit unitedwaycwc.org/Women United to learn more and see how you can get involved today.
All right, Katie, we are back, and I want to just take a minute to dig into something you said at the beginning, which is that you're looking to grow your housing work. And I'm curious if you can give us just a little bit of a teaser of what that might look like.
Sure. So as I mentioned in the beginning, we manage housing. So we don't own housing, but we manage it. But we do have planning and zoning approval to build a 79-unit affordable senior preference housing actually in the backyard of our headquarters building. So if you've been to our main location at 120 Main Street in Danbury, we have a parking lot in the back right now with Patients Park. But we do have plans to build a 2-story parking garage so that we're not displacing the parking with those 79 units of affordable housing on top of it. And our hope is that shovels will be in the ground by the end of this year.
Wow.
On that. Yes. So we are in the process right now of working with all the state funding sources to hopefully make that happen.
And would that be ownership and management of, or management?
So it would be management of, to avoid getting too complicated.
That's fine. You can just leave it there. You'll continue to manage property.
We'll continue to manage property. It will likely be owned by, ownership will be with a tax credit partner initially, and then potentially an affiliate thereafter.
Okay. That's really exciting. And we know, there's obviously a lot around housing, the need for more housing, particularly the need for senior housing. So I love that you're looking at it through that lens. And in my mind, there's such an arc there for you all, from being in the early care and education space with our youngest learners to then looking kind of full
lifespan.
spectrum, full lifespan to, we can't forget that our older adults also need to be housed and taken care of. And so what a cool thing. And there's so many intergenerational initiatives these days too. So I'll be curious whether there's the ability to do anything there.
And what's interesting for us too, that you pointed out the lifespan, but because of, if you know where we are and where our building is located in downtown Danbury, it will be right next to our health center. So talk about access for healthcare services, but it's around the corner from our largest early childhood location in Danbury, literally in walking distance, and then right next door to the Danbury Community Center, which is where the Boys and Girls Club is now working to provide services for kids, but on off hours, it's a community center. So it's all sort of connected, and it's just nice that it's all so close by, and there's opportunity to really make those tie-ins, like you said.
Yeah, it's a nice kind of campus feel, right?
Yeah,
if you will.
Exactly.
And just so centrally located. So that's great.
Yes.
We will have to wait and see where you land and bring you back on to talk about that.
Yeah.
So that's one phenomenal new thing. You just mentioned a partnership with Boys and Girls Club.
Yes.
Do you want to just highlight any innovations or kind of program developments, evolutions that you're excited about?
So I did mention the Boys and Girls Club, and I want to just do another plug for that. So we have partnered with them to run programming in a building that our affiliate owns at Boughton Street, 12 Boughton Street in Danbury, which is, again, right off of Main Street. And I think they're in 2 weeks in there. And the latest numbers are that last week, 160 children were already enrolled. So we're so excited about that. I know.
Kudos to the Boys and Girls Club for jumping right in.
They are just doing such a great job. So I want to give a shout out to that. And again, that's really a partnership. We own the building, but they are running the program and just bringing such a needed service to after school programming and leadership programming for kids. So that's wonderful. In terms of some things that we're doing in-house at Civic, there's so many things that I could talk about, but I'm just going to highlight a few. In the last 6 months, especially in our health center, we've added chiropractic services and some healthy weight management services. And again, I talked about community need, but we added the chiropractic services because when you talk about referring out for things, these are two services that we're referring patients out for.
Okay.
And in chiropractic services, we found that there were very few chiropractors in the community that would accept Medicaid patients, and there was a 6-month wait. So that was part of the impetus for bringing it in-house. And what's so nice about connecting that with primary care is you want people to explore pain management options that don't involve medication. And so this is just another way to do that. So we're thrilled about that. There's a lot in the news these days about healthy weight and medications to assist with that. Our program on healthy weight management is not necessarily geared 100% towards medication. That's certainly an option, but it's about lifestyle and behavioral changes and making sure that anyone who wants to access that service can have access to it, and cost is not a barrier. And so we're offering that now for our patients. It's a virtual service through telehealth, and so that's an innovation. And then we've been a teaching health center for many, many years, but I always like to highlight that as part of our innovation because we are the only teaching health center in the state of Connecticut. We train post-MD doctors every year, almost 30 in internal medicine every year. And as of this July, it will be 16 in psychiatry, with the goal that we're training them in a setting that will allow that will generate interest in working in community health centers like ours and with underserved patients. And we've seen great success, and that the physicians go on to primary care, because that is an area where there's going to be a huge shortage in the future. So we're very that's just an example of one of the things we do here. We have a simulation lab for our residents. So there's a lot of really just interesting things, in many layers of what we do.
That's so interesting that primary care is looking at having a shortage
Huge
in physicians down the road. But it is one of the things that as we've worked together, Katie, over the years, learning that you have that teaching component, because you want people to experience working in and serving what may be more vulnerable populations. And you just think about how much that opens up the eyes of doctors and students who may not otherwise have that experience, and what and how that pulls you to that work, right? So many of us in the nonprofit sector know that the moment you get into this, you're drawn to it, right? and we don't leave this space. So I think being able to do that with other industries, it has to be such a valuable long-term outcome.
So our internal medicine residency program has been around now almost 13 years. And so we have data of our graduates. We have over 75 physicians that have graduated from our program, and our data doesn't lie. Overwhelmingly, our graduates go on to work in primary care and in underserved communities. And when you look at national statistics, it's almost double the rate of what they would in a different sort of training program, a hospital-based training program, where they're not necessarily getting that same exposure to a community-based setting. So we're very proud of that. And
I wonder how we get more federally health centers to do that. So we'll stick that in a bucket.
I'll be happy to talk with you about that another time.
Absolutely. So Katie, I just want to kind of wrap up with this question we end with for everybody, which is, when you think about the work that you do every day, what gives you hope that change is taking root, right? Like, what's that thing that fuels you?
What fuels me is just the energy and enthusiasm from our staff and how they show up every single day, even when there's so much uncertainty in the world, that they show just care to anyone who walks in the door, in our early childhood space, in our health space. They're just so committed to what we do. It makes my life so much. I mean, it's just a joyful place to be when there's mission behind it. And it sounds sort of trite, but it's true. You feel like you're making a difference in the lives of people. And you see that every day. We see that in health outcomes. We see that in our early childhood outcomes when we look at data. And it can be hard when it's hard work. It's not easy, but people keep showing up and putting in, or just showing their commitment all the time.
Yeah, I think you feel that anytime you walk into Civic and we engage with anybody on your team. They have never been anything but passionate about, in love with their work, and so willing to dive into ways that they can do more and do better, be strong partners in order to, at the end of the day, really support a community that is in desperate need of these services. So kudos to you and your leadership.
Thank you so much. I really appreciate it.
So thank you, Katie, for joining me, for sharing your insights. We always put up the link to the organization we speak with, and so we will make sure to share more about Civic. And always folks can go onto our website as well. But thank you again for joining us. I'm Ashley Gaudiano. This is Rooted in Impact. Thank you for listening. At United Way of Coastal and Western Connecticut, we work side by side with our community to address critical needs and advance equitable pathways to well-being and financial security for everyone. Rooted in Impact is a podcast that highlights how we are making a difference in our communities. Thank you so much for listening. If you want to learn more about us, visit unitedwaycwc.org. And if you're interested in being our podcast sponsor, we'd love to have you. You can find new episodes every other Tuesday wherever you get your podcasts, including Spotify and Apple Podcasts.